Hello, everyone. Good morning, good afternoon, good evening from wherever you are in the world. My name is Bruno Hellman, and I will have the challenge to replace Professor João Nabais, IDF Vice President, that unfortunately had a last-minute commitment with the Science and Education Ministry of Portugal and won't be able to join us today. So without further ado, let's go to the next slide, please. So just some housekeeping rules before we start the session. So this webinar will be recorded. Activate soon generated subtitles by clicking on the closed captions CC at the bottom of your window. Note that the subtitles are not 100% accurate since they are generated by artificial intelligence. The recording, the slides, and feedback questionnaire will be sent to all registrants in a few days. Participants who attend this session live will receive an attendance certificate, so please check your spam folders if you have not received them by December 12th. And please use the Q&A function to post your questions to speakers and panelists. Next slide, please. So now it's my great pleasure and honor to invite IDF President, Professor Akhtar Hussain, who recorded us a message about his thoughts and reflections on the KiDS program. So let's listen to him.
Hello, I'm Professor Akhtar Hussain, President of the International Diabetes Federation. It is my pleasure to welcome you all to this webinar celebrating the 10-year anniversary of the KiDS and Diabetes in School program. Launched in 2013, the program was developed by IDF, the International Society for Pediatric and Adolescent Diabetes, and Sanofi. It has brought diabetes education and awareness into schools to reduce stigma, promote healthy lifestyles, and help tackle the preventable risk factors for type 2 diabetes. 10 years is an important milestone and opportunity to celebrate key achievements. Schools play a vital role in educating and shaping their behavior. Through interactive lessons and educational materials, the KiDS program targets children at a younger age. It delivers important information to create a safe and supportive environment for children living with diabetes, and it contributes to the well-being of the community by encouraging healthy habits. Over the last decades, KiDS has provided education on diabetes management and prevention to more than 340,000 students and 19,000 teachers in 14 countries. During this webinar, you will also learn about the positive impact of the KiDS activities and their first-hand experience of successful implementation. I'm encouraged by and proud of everything that the KiDS program has achieved over the last 10 years and look forward to seeing the program continues to grow and reach more children and school staff in the coming years. My heartfelt thanks go to ISPAD and Sanofi for their ongoing and unwavering support for KiDS. And I thank you all for joining us today to mark this very special occasion.
Thanks, Professor Hussain, and echoing your message, we couldn't be here today 10 years after the program was piloted without the ongoing and continuous support from ISPAD and Sanofi. So let's now listen to Olivier Chamel, Executive Vice President of General Medicine Sanofi, who will be sharing a bit about the importance of the program for Sanofi.
Thank you for the opportunity to take part in this celebration marking 10 years of KiDS and diabetes in schools. I would like to have joined in person, of course, but this is a particularly busy time of the year. I did, though, wanted to take the opportunity to speak briefly about this important program. For me, KiDS is an excellent example of partners coming together to have a greater impact than they could on their own. In 2013, the International Diabetes Federation, the International Society for Pediatric and Adolescent Diabetes, and Sanofi saw that there was a real need to reach children and families with diabetes education through schools. The partners also saw that they could have greater reach and impact by coming together. It is that partnership approach that has sustained KiDS over the last 10 years and that set it up to achieve even more in the future. At Sanofi, we are happy to back this program in various ways. I'm particularly pleased that many of our country teams are centrally involved in the rollout of KiDS. Indeed, it's a source of pride to them and drives engagement as our colleagues know they are making a difference and helping young people with diabetes or at risk from it. The global approach, where a global program is adapted to fit the local context, is very powerful and means resources are well used and there is no duplication of effort, creating new materials where they already exist and can be translated. So to close, I'm delighted to see KiDS celebrate 10 years of impact. I'm proud of the part Sanofi plays with our partners in the program, and I'm excited to hear that there are now a further 7 countries coming on board, bringing KiDS further faster. So thank you and congratulations for all you have done so far, and good luck for the road ahead. For KiDS, the best is yet to come.
Thank you, Olivier and Sanofi, for making the difference on children living with diabetes and those at risk. As mentioned both by Olivier and by Professor Hussein, without ISPAD, we wouldn't be able to accomplish everything that we have done so far. So now it's my great pleasure to invite Professor Gun Sander from Sweden, who is the lead person of the Diabetes in Schools interest group. Thank you, Gun, and the floor is yours.
Thank you very much, and thank you for inviting me to this important webinar. I was asked to talk a little bit, a very brief summary of type 2, the problems in type 2 diabetes in young people, which is not actually my main topic scientifically or clinically here in Sweden, because we have very few of them actually. But type 2 diabetes is a tremendous challenge for a young person. And it is more severe and more rapidly progressive condition in comparison to adult people. And you know, many young people have older relatives with type 2 diabetes, and which they perhaps not look upon as a very severe disease. But when a young person and a school teenager, for example, get type 2 diabetes, it is an extremely dangerous and rapidly progressive condition, which everyone has to know about. Compared to adults, youth have around 50% lower insulin sensitivity, regardless of race, ethnicity, sex, or BMI. And it is discussed quite a lot what this is caused by, and severe insulin resistance in youth and the hyper-responsiveness of beta cells may play a role in the occurrence of type 2 diabetes at a young age. Next slide, please. Family history, genetics, and sex are not modifiable, but as for type 1 diabetes, screening for type 2 diabetes has been a hot topic the last years. Screening tests for type 2 in youth should be considered after the onset of puberty or age 10 years of age, whichever is earlier. in youth with BMI above 85th percentiles for age and sex, with one or more of the following situations. Could be a family history of type 2 in the first or second degree relative. It could be that the young person belonging to a race or ethnicity, which is particularly at risk, for example, being Black or Native American or coming from the Middle Eastern, Pacific Islander, Australian Indigenous or Canadian First Nations. And if the young person shows signs of insulin resistance, that could be acanthosis nigricans. It could be hypertensive disorder, dyslipidemia, polycystic ovary syndrome, or was born small for gestational age, or on the contrary, a high birth weight, as well as if it was a maternal history of type 2 diabetes or gestational diabetes during the child's gestation. And the current use of atypical antipsychotic agents associated with weight gain. So as you can understand, there's quite a lot of young people of today that are actually in risk for type 2 diabetes. Next slide, please. As I mentioned, some risk factors are not modifiable, but there are modifiable risk factors. For example, obesity, nutrition factors, degree of activity, and the sedentary time. They are at least theoretically possible to modify, but it's a very big challenge for a young person, and especially challenges without a structured approach. Disordered eating in the context of obesity may also be contributory. And low physical activity, increased sedentary time, and excess screen time also contribute to obesity, insulin resistance, and diabetes risk for type 2. And currently, at least when the ISPAD guidelines was putting their references for type 2 diabetes in the guidelines, evidence for effective interventions targeting lifestyle changes in the prevention of young onset of type 2 diabetes are at least partly lacking. So we have still a really challenge to make this come true, that we can prevent or at least treat type 2 diabetes effectively in the young people. I stop there for the moment, but I will be happy to come back in the panel discussion later on.
Thank you, Professor Gun. Now we move directly to the state of Goa in India to hear from Dr. Rupa Naik from the health service, who recorded us a message sharing a bit about her experience over the past 10 years of the kids in the state of Goa.
My name is Dr. Rupa Naik, Deputy Director, Public Health, Government of Goa, Directorate of Health Services. I would like to tell about the KiDS program in Goa. It is a well-known fact that children in the age group 5 to 15 years are having the risk factors for non-communicable diseases. We realizing this way back in 2019, we started the KiDS Sanofi program with the collaboration of Government of Goa with Sanofi, and we incorporated the Department of Health and Education. Here we intended to create awareness and also capacity building of the teachers, heads of schools, and also finally the children. With this, we started training the school health doctors, who are called the RBSK doctors. And these teachers and the school health doctors in turn train the students on healthy lifestyle and diabetes also. And here the message was taken home by the children and told to the parents, who themselves were educated on healthy lifestyles. Since 2019, we have trained 450 schools, which are mainly secondary schools. We trained 1,600 teachers and heads of schools, and we also trained 150,000 students. The program is well received in the state of Goa, with the driving force of the education department and also the health department. We hold quarterly reviews with the school health team and also with the education department, and we conduct quarterly reviews along with workshops for the teachers and the heads of schools. Also, videos and messages are dispersed to the children, enhances their knowledge on healthy lifestyles and diabetes. The COVID pandemic was the biggest challenge when all the schools were closed. However, the children were at home and the parents and the teachers were interacting on an online mode. So we took this opportunity whereby the teachers we trained on a virtual platform, and also the school health doctors also we trained on the virtual platform, and these teachers in turn communicated virtually with the children and the parents, and this had an added advantage that the parents also were made aware of the healthy lifestyle and diabetes. Knowing that the KiDS program has shaped the life of the children and also the habits of the children, we have entered in a PPP mode and extended the program further by 3 years. And to sustain this, we are having training modules which are hosted on the government portal and which will train the teachers, almost 12,000 odd more teachers in this program. KiDS is a well-defined and structured program, and now we have realized that the children are having better understanding and empathy with the children of diabetes. This program has the potential to scale up in other states, and I also urge the other states to take up this program forward for the very reason that this creates awareness on healthy lifestyles in the children and also will bring about a healthy nation.
Thank you very much, Dr. Rupa, for sharing the outstanding work that the state of Goa has been doing. And thanks for your long-term commitment. And I hope this message is able to be delivered to other government decision makers, and that more governments around the world, regardless of being a local, a regional or national government, is able to implement the KiDS program. Now, without further ado, it's my huge pleasure to invite Vivian Chow, Heads of Communication of Sanofi Great China, who will mention to us some exciting news about next steps of the KiDS program in the country. Vivian, over to you.
Thank you, Bruno. Good morning, good afternoon, and good evening to all the colleagues and friends around the world. I'm so honored to join the celebration of the 10-year milestone of KiDS. And we can see this program is making a real difference around the world. So excited to be part of the program. And we have decided to launch the KiDS program in China from this year. So I think this is a very important and exciting moment for China, for Sanofi in China, and for the upcoming program here in China. In the area of diabetes prevention and treatment, there are huge unmet health needs in China, actually. China has the largest population with diabetes in the world, over 140 million. And the absolute number of children with type 1 diabetes patients in China ranks the 4th across the world. However, the public awareness of diabetes and its management is still relatively low. And awareness of type 1 diabetes is even lower and there's a strong sense of stigma among patients and their families. So with the introduction of KiDS into China, Sanofi aims to build up sustainable solutions for Chinese kids and people in diabetes from treatment to prevention. Our aspiration is to bring the KiDS program to Chinese schools nationwide, raising awareness of and tracking stigma around childhood diabetes. We're taking a phased approach to launch the program in Shanghai and then to other cities because, you know, China is such a big country, but we have a long-term commitment to build the impact of KiDS in the country for the upcoming years, with the penetration into the 300 million child population in China. Actually, we have already launched a campaign in China with our employees to educate and inspire our internal excitement. It paves the way to collaborate on employees bringing KiDS to local schools through our volunteering programs across the country. More engagement of our employees will be leveraged to utilize their healthcare expertise and improve their belonging to the program. In the meanwhile, we have held a media event with the theme of Brighten the Future of Diabetes in China in November. Stakeholders, including patient advocates, KOLs in diabetes, and the mainstream media, were invited to discuss how to benefit children with diabetes from prevention to treatment. There are very good feedback, and we got over 160 press reports, reaching a population about 46 million. So it's already a very good start for us, but we believe we can do more. We believe KiDS program offers a unique and invaluable experience for the kids here in China, and also to help us to really bring innovative diabetes-related solutions to improve people's life here in China. So we're looking forward to joining hands with all of you for the success of KiDS in the next 10 years and beyond. Thank you very much.
Thank you very much, Evan. And yeah, we are really excited to see the next steps of the program, and definitely China will play a vital role on this path. So if we could move to the next slide, please. So now I'm gonna invite Professor Gun and Vivian to be joined by Fiona Olivier, the Global Head Corporate Affairs, General Medicine Sanofi, who will be participating on the discussion panel and the Q&A here with us. So I remind everyone to please share your questions and comments using the Q&A button on your app. So the first question that I would like to address, it came from an anonymous person, but is actually to me. So what is the IDF perspective on the kids? Is the program focused on type 1 or type 2? So the important to make clear here is that IDF understand and acknowledge all types of diabetes, and we don't make distinctions between them. We understand that each type requires some sort of different approach. So for us, the KiDS program is fundamental to fight the stigma against children and students living with type 1 diabetes, which could lead to better health outcomes for students that already have the diagnosis. But also, we want to improve the awareness and education about all types of diabetes, especially preventing the type 2, which is in line with WHO targets and the Sustainable Development Goals. So on this, talking about the relevance and the importance, I'd like to ask you, Fiona, like after 10 years of the program was pilot. What is the importance of the KiDS for Sanofi?
Thanks, Bruno, and thanks for inviting us to be part of today's 10-year celebration. And just to respond, because there was a question in the chat there about, well, what is Sanofi? And Brian on my team has put in a response, but essentially we're a global healthcare company, and we have been in diabetes for 100 years. And so we're very committed to the community of people with diabetes. And so 10 years ago, when a couple of our employees saw the need for doing something around education and prevention with children, they were delighted to be able to contact, yourselves at IDF and people at ISPAD to build this program together, which over the 10 years of its existence, I think the numbers are extraordinary, has impacted around 340,000 children, over 2,000 teachers, and many, many thousands of schools. And that is thanks to not only IDF and ISPAD and colleagues and employees and volunteers from all over Sanofi, but it's also very much thanks to the many doctors and nurses all around the world and people in the diabetes community who download the materials and who use them in workshops in schools, and also who are working towards, working with government officials to try and change policy so that education around diabetes in schools can become part of national programs. So to summarize, it's really important to us. Yes, we make medicines and solutions, but we're also in the business of prevention. And so this initiative really speaks to us from that perspective.
Perfect. Thank you very much. Talking about prevention, Professor Gun, really quickly, because we have some wide audience here, and not everyone may be familiar with the main difference between type 1 and type 2. So if you could just briefly mention the difference between type 1 and type 2, and just linking to another question that came to the chat, is how a healthcare professional can differentiate type 1 and type 2 on children. So when someone is seeking to a doctor visit, a doctor appointment, how the healthcare professional make that differentiation?
Thank you, Bruno. Mostly it's not a tricky question whether it is type 1 or type 2, but it could be, especially in this time with the growing incidence of obesity and overweight in children and young people all over the world. But to start with, type 1 diabetes is regarded as an autoimmune disease that could strike anyone with some genetic sensitivity in the background, so to speak. And we know that type 1 diabetes is a mixture of genetic disposability and environmental background. And those environmental factors are still at least partly unknown. And to make a real diagnosis of type 1 diabetes, except from the normal way to just check blood glucose and see if it's elevated, either as a fasting glucose or a random sample. You can, if you want to be sure that it is a type 1 disease we are discussing, you should check for HLA, that is the genetic predisposal factors, and the insulin and other type 1 diabetes specific autoantibodies. And then you can be quite sure that it is a type 1 diabetes. But on the other hand, we are more and more convinced now that type 1 diabetes is not one disease. It could be, it's very heterogeneous. So we are more in now thinking that type 1 diabetes is just an umbrella description of similar but not identical diseases, mainly for young people, for children and young people, but also for adult people. If you then have an obese or overweight child or young person that has passed puberty or are in puberty, it could be tricky to start with to know if it is a type 1 or type 2, actually. It's never wrong to start with insulin treatment if you need, and then change for oral drugs if you are convinced that it is a type 2. Type 2 is not an autoimmune disease, and usually you don't see any autoantibodies, and usually the HLA genetics are a bit different or quite different to type 1. But if you are in a country where you are not very easily access to HLA testing, that is the genetic testing, and the autoantibodies, it is tricky. But you can safely always start with insulin treatment, and then when you are convinced what kind of diabetes you are dealing with, you can change into metformin, for example, and if needed, complete with have a complementary treatment with insulin or the more updated modern drugs if necessary.
Thank you, Professor Gunn. Talking about testing, we are aware this is not your main area of expertise, but could you comment what could be the clinical implications of testing insulin resistance in young people?
I mean, sometimes I think it's necessary if you are still in doubt what kind of diabetes you are dealing with, and then you can go for example, an oral glucose tolerance test, or maybe an intravenous glucose tolerance test, for example, or use the HOMA algorithm or something like that. But we have also clinical signs, indications of insulin resistance, as I mentioned it in my first little speech with acanthosis nigricans. Then it's if you are unusually colored, so to speak, in your neck and in your arm bows, etc. So you have some signs, and if the young person is very obese in the stomach, in that region, and less thin, more thin in the arms and legs, it could be also a sign of elevated insulin resistance.
Thank you. Moving now to a different question that came from our audience. Fiona, maybe if you could comment, and then I can elaborate. So if you could please describe the evaluation and the success measures with the direct outcomes of the KiDS program. So if you could let us know more about what the affiliates do to implement the KiDS and how they report the impact, Fiona, and then I add on the IDF perspective. Your mic is closed.
Thank you. So thanks for the question. I think measurement and KPIs is always a topic that's an important one and not always the easiest one to implement. And I would say that over the last 10 years, we have some very basic but important measures: numbers of kids impacted, numbers of teachers, numbers of families, numbers of school nurses and doctors, numbers of in terms of how many people have gone through the different trainings or programs. Then we have things like numbers of downloads of materials from websites. And in some of the countries, after the workshops, there are questionnaires that are given to the children and to the different people who participate in the questionnaires. I think we could probably go further. If anybody has ideas, they can certainly put them in the chat. We're always welcoming new ideas. I think what would be a great next step is to really try and understand, has it changed behaviors? Has it helped children in any concrete way, and how can we measure that? And Bruno, maybe you might comment. I know there was a study done in a couple of countries some years ago, and you know, I definitely think this is something we need to step up our game on.
Yeah, definitely, Fiona. Since our main target audience are students, are children, so measuring some of the outcomes are quite challenging, but in line with what Fiona just said, it doesn't mean we are not working on that. We have the results from the pilots conducted both in Brazil and India 9 years ago, and now we are working on improving the measurement methodology for the short and middle term impact. For us, is really essential, not only to promote diabetes education and awareness on a sense of combating and fighting stigma and discrimination, but also promoting healthy habits and well-being. So in this sense, we are currently working on a methodology on which we could access and measure if after attending one of the educational sessions, the students improve some of the outcomes. So for example, if they started to exercise more, if they started to eat more fruits and veggies. But again, this is a ongoing process, and we don't have all the answers, and we are always open to collaborate and learn from the folks who have experience. So just another question, and then I will answer and then link to Vivian. That is how the program can be tailored to the local needs and different communities we serve. And then also there are people asking about translations to reach more children, notably in countries with high language diversity, for example, India. So how can IDF and Sanofi provide those translations? So I'm just gonna bring the IDF perspective, and then I'm gonna pass to Vivian to ask what was the approach in China. So of course, IDF would have all the resources, translations to all the languages available in the world, but realistically speaking, this is not feasible. So we collaborate closely with Sanofi and ISPAD members for translations of certain countries. From other countries, we receive the work conducted by volunteers that want to bring the program to their own country. So for us, this type of partnership or collaboration or support of volunteers on translating the resources is fundamental to ensure that we can cover the largest number of countries and languages as possible. So if you are willing to work on the translations of the kids materials to your country, please send us an email. We're gonna share the kids' email address at the end of the presentation. But also I invite everyone to check the kids' resources, and you might be surprised that the resources are available in your language and you don't even know it. So just passing to Vivian, if you could mention, Vivian, like what has been the approach of the when it comes to adaptations and translations of the resources to China and obviously Mandarin.
Thank you, Bruno. Yeah, we are doing the localization I think it's not only translation, but also localization of the KiDS program materials in China. We want to make it more relevant to kids here in China. And also what we're trying to, with support from KiDS and also from a global team, to upgrade or adapt the program here in China. We just want to focus more on the psychological caring part because there are stigma for the among patients and their families. So we think this is important to provide those kinds of mental caring to both the diabetes patients and their parents, I mean the children and their parents, their families, to relieving their their nerve and anxiety due to the stigma. Then we can help them foster a better parent-child relationship and establish a friendly school environment with a connection with parents and the teachers. As mentioned that we had a press conference of a media event. There are one advocate from the patient organization. He mentioned that he himself was a patient, but he mentioned that after he got the type 1 diabetes, the relationship between his parents actually become very intense because they are so anxious while there are a lot of pressure on the family. So we really think there are a lot of things we can do to help them. Thank you.
Thank you, Vivian. And something that we are aware of, and during your one of your interventions at the ISPAD Congress, Professor Gunn, you mentioned how diabetes or unmanaged diabetes could potentially impact child's development and studying performance. So if you could mention that about some of those studies that you refer to, and what is both the physiological and psychological impact on students living with diabetes.
Yeah, that's a great but difficult question. But it used to be a fear of hypoglycemia that caused people being very anxious. I mean, the parental fear of hypo has prevented many children in the world to have normalized glycemic control, because people have been so afraid of hypos that it was used to be thought that it usually thought that that was the thing that could make the mental development of the child very challenged. But nowadays we know that there's a hyperglycemia, which also causes, of course, the big troubles for the type 2 kids, that causes the risk for less good school performance, etc., and from brain damages, actually. So the message nowadays, as long as at least when you have access to more updated modern technology, is to try to reach normal glycemia as good as you can, because both hypo and hyperglycemia should be avoided to protect both the mental and the more physiological development of the child. And that's a big challenge, and it's not easy, absolutely not. And it causes so much stress and efforts from the family and even from the society, for example, regarding the school situations. So because of that, it's so important that both KiDS program and ISPAD, for example, working with this position statement that we have just launched. I mean, all these resources are so important to promote the situation for children with diabetes in the world.
And share with our audience, Professor Gunn, for those who are not yet familiar with the ISPAD position statement, please.
Yeah, the first position statement was published in 2018, sorry, I'm not really that old. but now we have been working the last 2 years actually with an updated version of our position statement. And this statement is regarded to be valid for all children in the world. And it states the global rights, the jurisdictional rights for children to have the right to be supported in their diabetes self-care during school time. And in some countries, for example, in Sweden, we have a law in Sweden to protect the children's right for help by a responsible adult during school day, because the parents are not thought to be able to support the child during school day. But in many countries, as we know, especially the mothers have to stop working their professional works to just support the child with diabetes. But actually, during school day, the school has the responsibility to support, and that is what we are really pointing out in this position statement. And it was launched now in the latest ISPAD meeting in Rotterdam in the middle of October, and in just another day, it will be put on the homepage of ISPAD, readable to anyone. You don't have to be a member of ISPAD to read it. But I just checked, and it's still the 2018 version that is. It's also very good, but now we have another updated version. So please read that, and if you have any comments, just send us a reaction. It is stated the names of us in the Special Interest Group for Diabetes in School Committee we are 8 or 9 persons in that committee now, so you can just tell us if you have any comments. So yeah, it's so important.
Thank you.
And can I just add too, Bruno, that we are happy in this Special Interest Group for Diabetes School of ISPAD to support KiDS program with an updated version of the educational material that you have, which we really appreciate.
Yeah, we are on behalf of IDF. We are eager and looking forward the next steps of this fructiferous collaboration. And again, if we are here celebrating the 10 years of success of the KiDS, it's because a partnership was established between IDF and ISPAD back in the days, and we have since then counted with the support from Sanofi. So some more practical questions coming from our audience regarding how they can run KiDS sessions in the communities. So KiDS have, as previously mentioned, several materials available in over than 25 languages. All the materials can be freely downloaded from our website. And what we invite and encourage everyone is that to download those resources, especially with focus on not necessarily using the resources to conduct educational sessions. Of course, if you do it, please share with us. We love to promote stories and testimonials and perspectives from all over the world. But also one of the key components of the KiDS program is to advocate, to ensure that like the government of Goa, other governments, regardless of the level, being national, regional, or local, bring to all the schools diabetes education programs. So for this specifically, we have developed the KiDS Advocacy Toolkit, which has tips to everyone to be able to advocate for diabetes educations in their own community. This is one of the best advocacy materials I have ever seen. So I highly encourage everyone to download these resources and share them with your network. Coming to also a more practical question regarding the KiDS implementation model. It's regarding funding. So with IDF support the implementation, financially speaking, and the answer is no. IDF support countries, support communities by sharing the resources, by sharing advice and knowledge, how they can become better advocates, but IDF doesn't have the mean to support national implementation. And of course, the countries that have been implementing the KiDS in a more structured way, the 14 countries that had successfully implemented the KiDS in the past 10 years, and the 7 new that are coming, it's also part of the IDF and Sanofi strategy. So maybe Fiona, if you'd like to mention like how this process goes with the affiliates and the relevance of now KiDS migrating for, I would say, a different type of setting that we were previously used.
Yeah, thank you, Bruno. I'm also furiously trying to respond to as many questions as I can in the chat and in the Q&A and the private questions. So a lot of interest in today's discussion. So to answer, and some of what I will say we've already talked a little bit about. Initially, the program started in Brazil and in India with very, very successful pilots there. Then it broadened out to a number of other countries where Sanofi team members also very much got involved. So there were 14 countries where Sanofi was very much working with local partners, with the IDF and the chapters of the IDF, locally with ISPAD members, and with other actually patient advocacy groups or advocacy groups, depending on the country. And what we've seen is that initially we had, as I mentioned, 14 countries, but we didn't have countries like China, we didn't have countries like Canada, we didn't have countries in the EU. And what I'm really pleased to say is that in the last year or so, we've started to see, thanks to the combined work of all of the partners, countries like France coming on board, Canada coming on board, Vivian is here from China coming on board, and many more. We've got 7 countries that have announced their intent to come on board. So what that means then, Bruno, is that in addition to working with local partners to do the workshops for kids in the schools, we're also working to try and change policy at a national level, and working, as you know, with yourself and the rest of the team at IDF, which is trying to change policy so that education around prevention management of diabetes is included in the school curriculum. And we do have that now in a couple of countries. So that's really the ambition, is the 2 strands: workshops and activities in schools, plus working to change policy so that it can be included in national curriculum. And I think that then we really increase the impact.
Thank you very much, Fiona. I'm afraid we are running out of time. There are like a couple of questions that unfortunately we haven't had the chance to answer, but feel free to share them with the KiDS email that we're gonna share shortly. But just to wrap up, looking at the future and improving the lives of children living with T1D, there was a really popular question in the chat, is that if there's any alternative to insulin. So Professor Guni, if you could like mention this, like what is the future holding for us, and also if Fiona, if you'd like to comment when it comes to T1D, if Sanofi has been working on developing new drugs, new technologies that could be a substitute for insulin.
Yes, we are living in very exciting times regarding diabetes, all kinds of diabetes actually, but regarding type 1 diabetes, we have new kids in the block, so to speak, and that makes the interest for screening for type 1 diabetes so essential and so really exciting. We are now thinking of type 1 diabetes in stage 3, where you really get the clinical diagnosis of type 1 diabetes. That when all the signs comes for hyperglycemia, etc., and the risk for ketoacidosis, etc. But now we are also discussing stage 1 and 2, and that's where stage 1 is when you have at least 2 diabetes-specific antibodies, and stage 2 is where you both have those antibodies and dysglycemia sometimes, for example, during fever or other kind of stress for the body. So the exciting times now is if you can kind of intervene in those very early stages, understand what's more causing the type 1 diabetes, and intervene with those exciting new drugs that are just around the corner, and also as teplizumab has been accepted for children from 6 or 8 years of age and older, to kind of not so far really prevent, but at least delay the onset of stage 3, that is clinical type 1 diabetes. It's so exciting, and we think that by now it will be more ways to perhaps in the future not need to use insulin as the one and only drug for treatment of type 1 diabetes. But if you can come into treatment long before the real stage 3 is there, you can hopefully prevent type 1 diabetes in the future. So that's a good message. And we know, I was perhaps a bit reluctant earlier in my speech that we have no really interventions to offer to prevent diabetes. I didn't mention this, but then I was talking about type 2 diabetes. But anyway, we know that physical activity per se, even just much more physical activity, can at least delay the onset of diabetes. So that is also a very good message.
Thank you, Professor Gunn. So just before we go to the closing remarks, I understand, Fiona, that you'd like to answer one of the questions coming from
no, I'm actually typing it. I just wanted to draw the guests' attention to the fact that I had already answered it earlier in the chat, Bruno. Thank you.
Okay, perfect. Okay, so once again, I'd like to thank Fiona, Vivian, and Professor Gunn for your great contribution, not only for this webinar, but also for the past, present, and future of the KiDS program. So thank you very much. And now just going to the closing remarks. So if you could put the slides back, thank you. Yep. Next slide, please. Thank you. So as mentioned, these are some of our materials. So we invite everyone to access the KiDS idf.org website, on where you can find all our resources. And next slide, please. For us, it's really important to hear from you, from your experience, your testimonials. So please considering answering these 2 questionnaires that we put together. One is for individuals and the other one is for organizations. So please scan them or go to the KiDS website and share your narratives with us. And last but not least, would like to remind that the slides, recording, and feedback questionnaire will be sent to all registrants in a few days. Please respond to the feedback questionnaire to help us to improve the future IDF online events. And if you have any questions, please address them to kids@idf.org. We thank everyone for your time, attendance, and we're looking forward the next steps of the kids program. Thank you.